Hello, everyone, and welcome to this webinar sponsored by Protecta and produced by our Hordes Dairyman team. My name is Abby Bauer, and I'm an editor for Hordes Dairyman magazine. Our webinar today is titled The Role of Dietary Phosphorus in Hypocalcemia, and we will be discussing the recent research on how reducing dietary phosphorus through both basal diet and phosphorus binders can help improve blood calcium and reduce the risk of fresh cow hypocalcemia. As you listen to the presentation, any questions that come to mind can be typed into the questions section of the GoToWebinar control panel. Also, if you would like a copy of the slides, you can find those in a PDF format in the handout section of that same control panel. Our speaker is Pat Hoffman, a homegrown Wisconsinite and Professor Emeritus at the University of Wisconsin-Madison. Pat received his bachelor's degree from the University of Wisconsin-Platteville and his master's from the University of Wisconsin-Madison. During his 37-year tenure at the University of Wisconsin, he conducted applied nutritional research on dairy cattle and was responsible for dairy outreach programs. He's currently the author of over 200 scientific manuscripts and abstracts and has received numerous awards for both his research and his educational programs. Pat, welcome to this webinar, and go ahead with your presentation.
Thank you, Abby. Good morning, everybody. It's a real pleasure to be back working with Hordes again and Abby. Also, thank you for Protecta for sponsoring this webinar. I hope the attendees find it interesting. There's a lot of new research that's coming through, much of it in the publication phase, and we want to share that with you this morning. The title, The Role of Dietary Phosphorus in Hypocalcemia. It seems like phosphorus is an old story, but as it turns out, it's a relatively new one. And so phosphorus seems like an old story, as I said, and in fact, it's relatively new. But we'll start out by showing the ancient tablets, if you will, although that's probably not quite fair, but we'll refer it to that way. I mean, for many years, at least in my career, calcium restriction was always talked about, especially by those who focus their research career on hypocalcemia. And this is a review slide. On the left is, the basic calcium mechanism that we were, I think, all taught or at least introduced to, and that's when blood calcium drops, parathyroid hormone rises, and it has an effect on converting an active form of vitamin D that increases intestinal absorption of calcium and renal retention of calcium and bone mobilization, and that's kind of called calcium homeostasis. And it then those combined metabolic factors increase the blood calcium. Well, it was thought, for many years, even back when I was in graduate school, which is some time ago, that if you could somehow restrict calcium in the diet prior to calving, that it would sort of enable this calcium homeostasis mechanism prior to calving, getting the cow to mobilize bone and to have her kidneys help retain calcium and increase calcium absorption out of the intestines to help prevent milk fever or hypocalcemia in cows. The graph on the right is sort of a review of that literature, and it's very interesting to note that if you can reduce dietary calcium down below 20 grams, which is in the far lower left hand corner there, you have a pretty good relationship or effect on reducing the clinical incidence of milk fever. If the grams of calcium in the diet are above 40 up to 140 on this graph, you can see by the scatter plot, which sort of looks like a shotgun pattern, there really isn't a very good relationship of doing this. So calcium restriction, dietary calcium restriction could work, but the problem is how do you get dietary calcium below this 20 grams a day? It's almost impossible to do. And as a result, this really never was a very effective, practical field strategy to reduce milk fever in dairy cows. If we go back, starting kind of in that same time period and look at dietary phosphorus research, which was sort of always under the radar and never really brought forth as much as the calcium homeostasis mechanisms that we learned about. There was some interesting things going on, starting back in the mid 70s. Bill Julian in 76, his paper in Dairy Science, reported that feeding dietary phosphorus less than 0.25% of the dry matter decreased milk fever by 50%. It was, never really approached as a management practice back then. Barb Barton in 87, I think she was working with Dr. Jorgensen at the University of Wisconsin, also found that feeding lower dietary phosphorus prepartum increased blood calcium levels at calving. Group in Michigan, feeding the lower levels of dietary phosphorus, they also reported higher blood calciums at calving. Then there was a meta-analysis out of the Florida group in the early 2000s that going from 0.3 to 0.4% phosphorus in the diet increased milk fever risk by 22%. Bill Weiss reported that overfeeding phosphorus during the prepartum period increased the risk of hypocalcemia. And recently, there's been some papers out of the group in Germany, Walter Grunberg's group, that have done very detailed measurements on this to try to look at the mechanisms of why reducing dietary phosphorus is improving blood calcium levels at calving, or sort of helping prevent as much hypocalcemia as calving. And we're going to show you some of those detailed studies, especially the Grunberg study that's highlighted in red there, to give you a view of a more detailed proposal of what these mechanisms might be. So here's some new research in the role of dietary phosphorus in hypocalcemia. This is a Wachter study, again, Walter Grunberg's group from Germany, and I'll try to do my best here on the webinar to point out the relevant points on the graph so that you can follow what the group is doing here. So starting 4 weeks prepartum to 7 weeks postpartum, they are feeding a diet which is in the closed circles around the bottom. They are feeding a diet that's 0.16 dietary phosphorus. Now that's traditionally below what we can do, but they did this through some restricted feeding and searching of special feedstuffs that were low in dietary phosphorus. And they compared that to feeding 0.3 dietary phosphorus, which is very typical of what we could do under a applied or commercial applications on our dairy herds. It's not overly difficult to feed a 0.3 dietary phosphorus during the pre-fesh period. And over on the y-axis here is the plasma phosphorus or blood phosphorus. And as you would expect, feeding lower dietary phosphorus reduced the amount of phosphorus that was in the blood fairly significantly. You'll notice that there's still this transient period that goes on, right at calving where blood phosphorus drops even lower. That's very similar to the transient period in calcium metabolism. So what they were able to do is to get the cow, by feeding her less phosphorus, to lower her blood phosphorus levels at calving. What's interesting is the corresponding response in blood calcium. It's, again, on this graph, we have days relative to calving on the x-axis, and now we have blood calcium on the y-axis. And what's very interesting is that the cows fed the lower dietary phosphorus had significantly improved blood calcium levels at calving. So when blood phosphorus was lower, blood calcium was greater. And this is in support of some of that older, more historical data that I showed you. But the group in Germany, did some additional measurements where I think, as a old professor doing this, I think this is where the fun and where the excitement is in this. And that is, they did bone markers of bone mobilization. This is CTX cross-lapse, which is it's just a marker of bone collagen in the blood. So it gives you an idea if the animal is resorbing bone, because the collagen or protein fraction of that spills out into the blood. So this is a bone sort of resorption marker, if you will. And if you notice that the cows or the animals fed 0.16 dietary phosphorus, which is this aqua sort of colored line, they had significantly greater levels of collagen in their blood, which means they were mobilizing more bone than the animals that were fed 0.3 dietary phosphorus. Now you notice that after calving, both sets of animals, the CTX cross-lapse measurements went up, and that's obviously due to the initiation of lactation and the demand for phosphorus. But where the important part of this slide, I think, lies is actually in the prepartum period, here back to minus 14 days. It gives us an idea that mechanism of bone mobilization was being initiated prepartum, similar to that calcium restriction theory. If we could feed low enough calcium prepartum, we could enact some bone mobilization. It looks like if we can feed a low enough dietary phosphorus value prepartum, we could also initiate some bone mobilization, which would of course bring calcium and phosphorus along, because they're in a 2-to-1 matrix in the bone. This is a very sort of plebeian slide of calcium homeostasis and phosphorus homeostasis. But I think, at least for today, it kind of brings out the relative points. As I discussed in the opening slide, dietary calcium restriction causes blood calcium levels to fall, which increases parathyroid hormone, which activates the vitamin D to its hormonal active form, calcitriol, which is responsible to increase renal retention of calcium and gut absorption of calcium. And also these two pair to increase bone mobilization. The old calcium restriction homeostasis theory, if you will, and what's typically taught. Phosphorus homeostasis, on the other hand, while it seems old, is actually quite new. If we have a dietary phosphorus restriction, blood phosphorus drops, like we showed you in the Wachter study, where they fed 0.6 and 0.3. When they fed 0.16 dietary phosphorus, those blood phosphorus levels were lower. That mechanism is primarily controlled by a bone hormone called FGF23. And that is also responsible for activating calcidiol 25 vitamin D to 125 vitamin D. The animal has a phosphorus homeostasis mechanism that is somewhat independent of the calcium mechanism, although they are intertwined. That also can increase bone mobilization of both calcium and phosphorus. So it's thought that this mechanism of FGF23 is at play in controlling when dietary phosphorus is low, is getting the animal to mobilize bone and to change kidney activity to maintain phosphorus. And it's not being so much controlled by the PTH mechanism. Now, for those of you who may not have ever heard of FGF23 and are so scientifically inclined, go ahead and do a search. It's relatively new. It's discovered, I think, in 2002. The first papers that appear in the animal science literature don't appear till 2011, 2014. So for us in animal science, although in the rat and mouse and human literature, there's a lot of work with it, it's just starting to appear in our science. Tommy Crenshaw at the University of Wisconsin did a masterful review of FGF23 and its role in phosphorus homeostasis for those of you that might be interested. So enter zeolite A into the picture. Zeolite A is a companion to this. It's a new approach to induce phosphorus restriction to prevent milk fever, to capitalize on this phosphorus homeostasis mechanism rather than the calcium homeostasis mechanism. It's a heavily studied sodium aluminosilicate. It's not particularly new. It is now commercially available to feed to dairy cows to reduce milk fever, to reduce subclinical hypocalcemia. And zeolite A is a phosphorus binder. It still gets named as a calcium binder a little bit, and we don't think that is correct. And we'll show you some data of why there's pretty solid evidence that zeolite A is working on the phosphorus side of the mechanism rather than on the calcium side. Zeolite A is fed 14 to 21 days pre-fresh, and it has been adopted by a lot of dairy producers around the country. Show you a zeolite A feeding study. This is the group out of Cornell, Kerwin's paper he's with Tom Overton's group out there, and they fed 55 pre-fresh dairy cows, and they fed 0.38 dietary phosphorus prepartum or 0.38 dietary phosphorus prepartum plus zeolite A. The cows were fed 21 days prior to calving, and they did the usual measurements that you would do in a hypocalcemia study: blood calcium, phosphorus, clinical milk fever, subclinical hypocalcemia, milk production, and colostrum quality. I put this study up in side by side with the Wachter study from Germany, just so that you can see the comparison between the two. So on the right hand graph is the Cornell study published in 2019, and both of these groups prepartum from, these data are from 6 to 0 days prepartum. Both of these groups were fed 0.38 dietary phosphorus. But if we look at the group right here in the open squares at the bottom, these are blood phosphorus values, and you can see those cows that were fed 0.38 dietary phosphorus plus zeolite had significantly lower blood phosphorus levels, to give us an indication that the zeolite is binding phosphorus and taking it down into this sort of transient phase of phosphorus homeostasis. The animals that were not fed zeolite A had significantly greater blood phosphoruses, somewhere at 6.5 milligrams per deciliter as compared to 3. So that's a pretty significant reduction in blood phosphorus levels by feeding zeolite A in companion with 0.38 dietary phosphorus. Look at this slide on the left. That's the Wachter study that I previously went through. Now the blood phosphorus levels are in millimoles over here, but the slides almost look identical. And so if we flip over and look and do the same little trick with the slides and look at the blood calcium levels, the slides again look identical. So in the Cornell study over here, the open squares are the animals that were fed zeolite that had the lower blood phosphorus levels. They have significantly greater blood calcium levels at calving as compared to the control group. And again, I switch your eyes back over to the right-hand side here and looking at the graph from the German paper by Walter Grunberg. Again, the blood calcium responses look almost identical to a dietary restriction of phosphorus. So this is what gives us this sort of clue as to zeolite A being a phosphorus binder and working on that phosphorus mechanism to get this animal to mobilize bone prior to calving. I'll share with you a bigger study that's Dr. Hernandez to see where they are in the publication process. I know it's at least in the review process. It might be in the in-press process as we speak. But this is a new study out of the University of Wisconsin. Probably the largest study that's been done on zeolite A to cows. There's 120 cows, so 40 cows on treatment, fed a control, fed DCAD diets, and also fed a diet containing zeolite A. The dietary phosphoruses here were somewhere around 0.36, I believe. I might be misspeaking about that, but they were pretty normal. The DCADs were plenty negative. I'm not going to show you the blood pH work, but the cows on the DCAD diet were well acidified. Lots of measurements in this study. Again, they started 24 days prepartum and monitored these cows, for 3-4 weeks postpartum, including some milk production data, etc. So they did so many measurements on this study. I can't possibly show them all to you, but I'll sort of cherry pick out some of the highlights here. If we look at the cows fed controlled diets, and this is from 14 days down here, 14 days prepartum up to calving. If we look at the blood phosphorus levels of these animals, the control is in yellow, and these animals would have what we call static blood phosphorus levels. DCAD, cows fed DCAD and negative DCAD diet had no change in blood phosphorus levels prior to calving. But if we look at these cows that were fed zeolite in concert with a relatively normal dietary phosphorus, they had significantly lower blood phosphorus levels, which means feeding the zeolite was inducing this mock dietary phosphorus restriction and putting these cows into a sort of a transient phase of hypophosphatemia. You notice when the zeolite is ended, the feeding period is ended at day 0, how fast the blood phosphorus levels rise. Now, to me, what's more fascinating about phosphorus measurements by Dr. Hernandez is the salivary phosphorus measurements. So over here in millimoles per liter, we have the salivary phosphorus concentrations. And this is where things are quite interesting. In the animals fed the control diet, they had moderate salivary phosphorus concentrations. Well, the animals fed DCAD actually had greater salivary phosphorus concentrations. And I think the reason for that may be twofold in this. This obviously could be an intake issue, but these are concentrations. And so maybe that cow-fed DCAD is trying to buffer this system a little bit. And that's been kind of shown in some of the DCAD research. But look at the salivary phosphorus concentrations of the animals fed zeolite. It's significantly lower. So why is saliva concentrations of phosphorus important here? Well, when dairy cows produce saliva, the primary buffer in saliva is phosphate buffer, HPO4. And so the animal recycles almost as much or more phosphorus through her saliva than she consumes in a day. So I'll give you an example of that. So if a cow consumes 40, 45 grams of dietary phosphorus, she's actually recycling 40 to 50 grams of phosphorus as HPO4 buffer back through the system. So the rumen is actually seeing sort of double what the dietary intake is. From a chemistry standpoint, as far as a binder, phosphate in its sort of readily available form would be one of the easiest things to, phosphorus would be one of the easiest things to bind because it's coming through as phosphate buffer in the saliva. And so this observation that Waneska and Dr. Hernandez made of decreased salivary phosphorus concentration, I think is very important to continue to understand the story of how zeolite is working as a phosphorus binder. If you look at calcium, blood calcium across the period, the study is really no different, except for the addition of the DCAD treatment, and it's really no different than the study from Cornell. Graph is presented a little bit differently, but the cows fed zeolite A improved their blood calcium concentrations almost at the onset of feeding zeolite A through the prepartum period. The decrease in blood calcium here through the calving period was significantly less than the control diet, and then blood calcium levels from 3 to 35 days postpartum are not different. The DCAD diet did help some with the loss in blood calcium at calving, with the control diet being the lowest. And that's a pretty typical response for DCAD. DCAD diets, of course, are thought to prime the parathyroid hormone receptors and maybe do some internal buffering of the metabolic acidosis with a little bone mobilization. So it seems to be what we would expect from one of these experiments. Here's a review. I probably need to update this a little bit. I did this a year ago, and there's a couple more papers that needed to be added to this, but this is a review of zeolite A feeding trials, again, staying on the phosphorus metabolism theme. And what I did with this is because these studies, they have so many blood measurements, pre-calving and post-calving, I just took the one closest to calving, and I just looked at the responses as a percent of the control. Sometimes it's feeding zeolite versus a benign control diet. Sometimes it's feeding zeolite versus a DCAD diet in a couple cases. But as you can see, farther over here on the graph, if you look at the responses of feeding zeolite A to pre-fresh cows, there's always a pretty significant decrease in blood phosphorus. What's interesting is that it's always commensurate here in this column. It's always commensurate with an increase in blood calcium at or around calving. So it again helps us define that the zeolite is not really acting on the calcium side of the equation as much as it's acting on the phosphorus side. Here's just a whole set of blood samples that were sent to me for some of my consulting work. And these are just average blood samples. I won't read too much into this, but these are just average blood samples from cows from 0 to 48 hours, post-calving blood calcium values, DCAD or zeolite diets. And it's probably not completely fair, but you can see the blood calcium levels in some of these cows, I don't know what their status is, but you can see that just as a general swat in the dark at this, that the blood calcium levels are almost 1 milligram per deciliter higher in the zeolite phosphorus binding approach to controlling hypocalcemia and milk fever, if you will. Just a few brief comments. Most of the concept of phosphorus homeostasis in dairy cattle, or at least in sheep and dairy cattle, and to some extent monogastrics, by picking and plucking the human and rat literature as a guide, we can fairly well lay out, blood phosphorus dropping and sort of what's going on with FGF23, although we need some better measurements of that, and how it would affect bone mobilization, and how it would increase calcium and blood calcium, and how it would reduce hypocalcemia and milk fever. So it's new. I mean, it's a mechanism that we're unfamiliar with, but we do have, I think, have enough pieces of the puzzle to at least lay a pretty solid foundation of what that mechanism is. Just to simplify this a little bit, if we take all of the research that's been involved with dietary phosphorus and blood phosphorus, if you take the older research with the newer research and sort of combine it with the zeolite research that's out there, it looks like, as we, at least prepartum in the blue, as we decrease blood phosphorus, and certainly we can't go too low with this, but if we induce a sort of a mild hypophosphatemia pre-calving, we can get the animal to drop her FGF23 and raise her 125 vitamin D levels and get bone mobilization going on prior to calving. And what this has shown is that it winds up producing less risk in the milk fever cascade or hypocalcemia. It seems as though the greater the blood phosphorus is, the more risk. And on this slide, DCAD and or controlled diets or benign neglect diets, they're not going to have much effect on blood phosphorus. DCAD is working on a different mechanism, well researched, but to implement a zeolite program, we sort of have to accept that we're purposely trying to induce this mild hypophosphatemia prior to calving to activate the phosphorus homeostasis mechanism. So it's required. And by doing so, seems to decrease the risk. In contrast to that is blood calcium. These are sort of typical blood calcium levels from the research, from zeolite, from DCAD, which also improves blood calcium as compared to a controlled diet. But as we increase blood calcium, the opposite of phosphorus, as we increase blood calcium, as we've all seen many presentations and seminars, we reduce the risk of milk fever and subclinical hypocalcemia. Just a couple of fun things to share with you that are not so much related to phosphorus, but I did want to point these out. There's other exciting new things going on in the milk fever world, if you will. The group at University of Wisconsin is also studying a compound called 5-HTP, which is a form of L-tryptophan that's a precursor to serotonin. And that group has shown that there, in the mammary gland, there's a parathyroid-related protein that can act like parathyroid hormone. So theoretically, if you can increase the amount of 5-HTP and serotonin and this parathyroid-related hormone, we may be able to provide another signal for this animal to increase her blood calcium due to a mammary calcium demand factor. And the group there has done some work with this, and it's pretty cool. It really is. These were IV infusions, but here's serum serotonin, and these open circles here are the infusion of 5-HTP. And sure enough, it increases serotonin. But over here in this right-hand graph, you can see that, days prior to calving and days after calving over here, these animals that were infused this 5-HTP, they also had greater blood calciums at calving, and it may be due to this parathyroid hormone-related protein, if you will. So there's some exciting work here with another mechanism that we traditionally have not been exposed to when it comes to preventing hypocalcemia and milk fever. There's also some work on a compound called Solanum glaucophyllum. This is a plant, it's in the nightshade family, that has natural active forms of 125 vitamin D that may help with intestinal absorption of calcium and kidney retention of calcium. So it would be feeding the active forms of this. This is being worked on, in some studies. This is a study of different kinds of boluses with this. I'm not going to point out all the individual lines here, but all of these are receiving some form of a bolus of Solanum glaucophyllum, which has the active form of 125 vitamin D in it. And sure enough, if you bolus this 48 to 72 to 96 hours later, there's a pretty significant rise in blood calcium level. The only trick to this whole thing would be is figuring out when to give the bolus. Okay, I mean, we don't exactly know when a cow is going to calve, but it does seem to be, effective at increasing blood calcium levels. There's also some studies with a compound called difructose anhydride. This is done by a research group in Japan. Difructose anhydride is a sort of an inert sugar, if you will. It's not digested, but it seems to change the boundary in the intestine to increase the absorption of calcium from the gut. Doesn't seem to work, as you can look at the graph, prepartum, and might need the help of vitamin D a little bit to activate its effects. I mean, that's a guess on my part. But it does seem to increase the level of blood calcium, at least postpartum. So that's another compound that's being worked on in the milk fever and hypocalcemia world. And finally, calcidiol, which is the form of vitamin D that's before 125, commercially available now. The group of Florida has done a ton of research with this. Calcidiol, this graph down here, calcidiol doesn't seem to affect sort of calcium homeostasis, if you will. The difference between the 4 lines here, or 2 and 2, if you will, is the difference between DCAD and control diet. Calcidiol is within each of those. It doesn't seem to affect blood calcium levels per se at calving, but the Florida group has shown a bunch of other work of potential beneficial effects, as an antioxidant and mastitis and some other things. So it's a little bit unfair to base the work on calcidiol on calcium metabolism per se, because there's some other animal benefits, and there's been some nice presentations at recent conferences on that. Phosphorus is a very important, plays a very important role in milk fever, and with the addition of zeolite A to the program here, to be able to get the cow to see sort of a moderate or mild phosphorus restriction, we can probably get that cow to mobilize a little bone before calving, and hopefully improve blood calcium levels at calving and reduce the risk of milk fever. So with that, I would finish. If anyone has any questions, I'll try to answer them. Thank you.
Thank you, Pat, for sharing this useful information and some of the new research surrounding hypocalcemia. We always appreciate your knowledge on dairy cattle and the insights that you share through your presentations. At this point in time, we will be answering questions, and we have a few questions that have come in already. If you have a question, please type that into the questions section of the GoToWebinar control panel. Also remind you, if you would like a copy of the slides, you can click on that handouts tab and you'll find a PDF of Pat's slides there. So to start off the question and answer section, people are looking for options for helping manage hypocalcemia in the herd. Pat, what do you think is the neatest part of Excelit and how it fits into a pre-fresh program?
With any program, there are advantages and certainly disadvantages. The two advantages I can think of zeolite feeding are urine pHs are not required, which can be routine for some farms, but problematic for other farms. And the second advantage is because it's operating on such an entirely different mechanism. The amount of dietary potassium in the diet is really not a factor so much in the success, which translates over to a pretty big issue with trying to procure forages that are low in potassium. I mean, it sounds easy, but sometimes it's quite difficult to do. In the case of zeolite, if we have some haylage in the pre-fresh diet, it's okay. Or some high quality small grain silage that might be higher in potassium, it's okay. And with that, with being able to feed some of those better forages that, yes, are higher in potassium, most of the time they're higher in protein. I mean, the protein supplementation cost in pre-fresh diets is not small, especially when you're using corn silage and really low quality forages. You have to back supplement those. And if you can use some forages at home, it can make life simpler.
Thank you for addressing that. Next question. Can you provide any data on whether or not zeolite A binds dietary calcium?
It may bind some, but there's some in vitro data where they looked at zeolite A. Zeolite A will bind some dietary calcium at higher pHs, like pHs, in the Roman 6. But when we get to the pHs of the abomasum, which is a pH of 3, it releases it back all. In the in vitro studies, it doesn't bind it very well. So binding capacity of materials is very pH dependent, and it's kind of the opposite with phosphorus. Zeolite A binds phosphorus really aggressively at low pHs in the abomasum. There is some early data with zeolite that it suggested it bound some calcium, but if you look at fecal data of calcium output in the feces, it wasn't a lot different. So it's a lot fuzzier than the phosphorus side of the equation.
All right, and someone else asked a very similar question, and then they followed that up with what is the best dietary calcium and phosphorus concentrations to use when you're using Excelit in the diet?
Typically, it's 0.3 to 0.35 phosphorus and 0.6 to 0.8 calcium. I mean, just sort of generic middle of the road values.
This is an interesting question. It says, zeolite is not recommended for heifers or primiparous cows. However, on smaller farms, not all farms are able to have two groups of dry cows where they can separate them out according to parity. Is there any concern on feeding zeolite to those younger cows? And would the recommendation change for a herd that can't separate cows by lactation number?
This is basically the same question that we've always faced when we've fed our DCAT or aniac salts. Some herds can't separate the the 2-year-olds from the older cows, I think the answer's pretty similar. We probably don't need these type of interventions for 2-year-olds, but sometimes the grouping strategy. I know of a number of herds that have combined 2-year-olds and multi-pairs cows, and it doesn't seem like the feeding strategy of feeding zeolite changes. Just like the DCAT diets, the strategies don't seem to change. The economics probably do change because we're feeding a group of animals that are probably not benefiting that much from it. So each individual dairy has to sort of weigh the pros and cons of that, just like feeding anionic salts.
Very good. We have someone in here that said that they use the product and they have a great experience. Other than the cost, they just want to know if there would be any risk for feeding it to, like, say, younger cows or maybe cows the full dry period. So no perceived risk other than probably they just don't need it. Just to reiterate what you just said.
Yes. Let me answer that. We shouldn't be feeding zeolite for the entire dry period. I mean, this is a product that's going to bind phosphorus, and feeding it too long both is not economical, and it's also probably not the best for the cow. I mean, really, zeolite probably could be fed 7-10 days is all that would be required, but because we don't know when a cow's going to calve, we get that out to 14 to 21 days to make sure that animals have been on it long enough. But the disadvantage of zeolite is that it shouldn't be fed in a 1-cow dry cow group. If that's the situation, we probably should use another approach to milk fever prevention.
Thank you for clarifying that. Do you relate the amount of zeolite with the grams of dietary phosphorus?
Yes, it's not a one feeding rate fits all. I think Protecta, the company, recommends something like 10 grams of zeolite product or xylate product per gram of dietary phosphorus. So you need to very specifically wet chemistry know your dietary phosphorus in your pre-fresh group, and you need to know your feeding rate group. And the company, the names are there. They can help you with the feeding rates in given situations.
Does zeolite bind trace minerals along with the phosphorus and possibly calcium?
I don't think this is just going to be a kind of more of a personal answer to this. I don't think the chemistry is very good in the rumen of a cow for zeolite to bind much more than phosphorus. And that's because phosphorus is in phosphate buffer form. It's so readily available, to have a binding site. I know that there have been some looks at selenium, zinc, copper maybe, no effect. Zeolite is binding magnesium, a mild binding effect on magnesium. It doesn't look like that zeolite is binding calcium, or at least selenium, copper, zinc, which have sort of been looked at. There's some evidence that it might bind a little magnesium, but that's really conflicted because cows that have greater hypocalcemia elevate their magnesium levels. So you don't know if it's a cow doing that or if the xylate is binding magnesium. I mean, it's kind of complicated, but there is a suggestion to increase your dietary magnesiums between 0.4 and 0.5 when feeding zeolite. You don't want to increase them much over that because you can create fecal soaps in cows.
Is there a more specific number for the binding level for phosphorus that xylate will provide? This person saying that the range looked rather large in a slide that you had shared.
There's a feeding rate of zeolite per gram of phosphorus. There's probably some limitations to that. For example, if we fed an extremely high phosphorus diet, would require a very high rate of zeolite, and that may get outside of the bounds of what we know. If we fed an extremely low level of dietary phosphorus, which is possible, I mean, if we got low enough, we probably wouldn't need to hardly feed any zeolite. So it's just really critical to know, the dietary phosphorus level and know how much zeolite is required to feed at that level, staying within reasonable bounds.
Now tap into just some general nutrition advice from you. What are some concerns maybe or issues that could arise with a dry cow ration that has a lot of straw in it? And then kind of tied with that, is there a big difference between particle length when you are mixing a ration for this group of cows?
Yeah, that's problematic. And it's problematic not just as concerning zeolite or anionic salts. If we get separation because of excess straw in the diet, and don't get an even distribution of these products to all cows, in the mixer, it can create challenges. And so things that help that pre-fresh diet be as homogeneous as possible are often very beneficial. I don't mean to be on a soapbox about this, but that's kind of one of the benefits of zeolite. If you don't have to worry about potassium so much, sometimes some haylage or small grain silage in those pre-fresh diets, now that you can use it, really make that diet more homogeneous rather than all corn silage and all straw, which sometimes can be a challenge.
Very good. Thank you for addressing those questions. Once again, I would like to thank our speaker, Pat Hoffman, a professor emeritus from the University of Wisconsin-Madison. Today's webinar was provided by Protecta, the company that brings you Excellent, a novel pre-fresh product that helps prevent hypocalcemia through binding dietary phosphorus. If you have any questions or interest in learning more about Excellent, please contact Rod Martin or Megan Connolly. Their contact information is on the slide that is on the screen at this time. On behalf of our team at Hoard's Dairyman, we thank you for joining us for this webcast by Protecta titled The Role of Dietary Phosphorus in Hypocalcemia. Please enjoy the rest of your day and take care.